We will be beginning the meeting in about 1 minute. About 1 minute. All right, Tracy, I have 2 o'clock if you want to get started.
Hey, thank you all for joining us this afternoon. We are going to be talking about COVID-19 and share some updates that's happened over the last week. We have members of our executive team here that will be answering those questions. Sean, I'm going to turn it over to you and let you maybe share some updates before we start.
All right, and I will remind, we've got a few people watching live, that if you have any questions, you can type them into the chat box, and if we can, we will try to answer them. I'm going to look to the board here for a minute. You'll see a side view as I give you a case count. We've had 108 total cases in Adair County, 19 of those deceased, 81 recovered, 8 currently active, 6 of those are on home isolation, 2 in the hospital. 14 total cases in KC, 0 deceased, 10 released, 4 active, all on home isolation. 5 total cases in Clinton, no deaths, all recovered. 6 total cases in Cumberland, 0 deceased, 5 recovered, 1 active case on home isolation. 4 in Greene, total cases, 1 deceased, 2 recovered, 1 still active on home isolation. 16 total cases in Macquarie, 0 deaths, 13 recovered, 3 active, all on home isolation. 84 in Pulaski, total cases, 2 deceased, 71 recovered, 11 active cases, 11 on home isolation. 39 total cases in Russell, 4 deceased, 32 recovered, 3 active cases, 2 on isolation, 1 in the hospital. 33 total cases in Taylor, 1 deceased, 18 recovered, 14 active cases, all on home isolation. 13 in Wayne, 0 deceased, 10 recovered, 3 current active cases, and they're all on home isolation for a total of 322 in our district. Total cases, 27 deceased, 247 recovered, 48 presently active, 45 of those isolated, 3 hospitalized. And our hot spot for the last few days has been Taylor County, where we've had the most growth. Some numbers I went back and looked at for the week of May the 23rd, or ending May the 23rd. That week we had 11 new cases. For the week of 5/30, ending 5/30, we had 11 new cases. For the week ending June 6th, we had 23 new cases that week. On the week ending June 13th, we added another 23 cases. On the week ending June 20th, we had 34 new cases added that week. And so far this week, through yesterday, we had 16 cases, and we've got 8 on the board today that will be added. So we'll probably have at least 8 new cases today, plus whatever comes in this afternoon. So that's 24 new cases so far this week, and we're about halfway through the week. So this could be our worst week. We're on track for that to happen as far as new cases. New cases is one way to look at the data, but there's another way I look at it also by looking at active cases, because total case count, a lot of those may be recovered and they're not spreading it in the community, but active cases, of course, have the potential to be spreading it. So on the week of 5/23, we had 10 active cases. On the week of 5/30, we had 11 active cases. That was a +1 increase from the week before. And you got to remember, for the active cases, there are new cases being added that are active, but there are recovery cases being released. So it's a more volatile number. But taking into account those that are added and those that have been released, on the week of 5/30, we had 11 active cases at the end of the week, which was one more than the previous week. On the week ending June 6th, we had 25 active cases, which was 14 more than the previous week. On the week of 6/13, we had 27 active cases, which was 2 more than the previous week. On the week ending June 20th, last Saturday night, we had 41 active cases. That was a plus 14. And so far this week, we're at 48 active cases. I'm assuming all 8 that's been added today will be active cases. That would be 56 active cases, which would already be plus 15 over last week. Now, by the time we end the week, there could be some more new cases, but there could be some more release cases. So I'm not sure where we'll end the week, but just through today, we've got had a larger increase of active cases than we've had in a while. So I think when we were at our peak, that was including the week that we had the nursing home outbreak. I think our peak was, did I say 87 a minute ago, Stuart? So 87 was our peak week, and right now we're at 56. So, taking into account that our last time we had such a high peak, it was early on in the process, and now we're later into it, and it seems to be ramping up. So that's kind of where we are. I guess on a positive note, the hospitalization rate and the mortality rate is not as high right now as it had been in the beginning. So that's good news. But there is a lot of community spread of COVID-19 right now. So Tracy, I'll turn it back over to you for a moment.
Okay. I want to remind everyone that if you have questions, if you go into the chat box and type those, we would appreciate that and encourage you to do that. First question, and actually we only have one question, is for you, Dr. Wayman. If a person was exposed to COVID-19 and are contacted by the contact tracers and can definitely remember that at the time they were wearing a mask, would they be required to be self-isolated?
It depends on the circumstances. Every case is somewhat different. Depends on how long the exposure was, at what distance, indoors or out, and what kind of type of mask the person was wearing. If it's a surgical or a cloth mask, that mostly protects the other person, not the wearer. So yes, they would be considered exposed and required to quarantine and self-monitor.
So there's a lot of variables and a lot of considerations that have to be made. Each case has to be handled uniquely and assessed. And
if somebody wore an appropriately fitted N95 mask, that may be different because that's considered protection of the person wearing it. Yes, and that's something there seems to be an awful lot of confusion about still in our communities, is that the purpose of wearing the cloth masks and the surgical mask is to protect others from you so that you keep your droplets and your particles contained. And it makes that 6-foot distance around you much safer if you've got a mask on. And as you said, it would take a fit-tested N95 mask to be protecting yourself. So the cloth masks and the surgical mask is basically source control, is to keep your particles contained so that you're not infecting other people. So you do need to wear the mask, but everyone needs to wear the mask to be effective. So that's a real challenge in our communities right now. There's a widespread complacency with wearing the masks, and masks have apparently, according to the latest research, proven to be very effective in helping to slow the spread. So we would certainly encourage everyone to wear a cloth mask or a surgical mask to protect others in case you have it and you don't know it and you're shedding it or symptomatic or contagious. Anything to add to that, Stuart? You were demonstrating some masks over there.
Just in simple terms, if I have it and I'm not wearing my mask, but you're wearing yours, you're not protected from me wearing a surgical or cloth mask, because because those don't do that. Only N95s do. So I need to be wearing my mask. You need to be wearing your mask.
Yeah. If you think about air, it's not a liquid, but it is fluid. And like any fluid, it follows the path of least resistance. So if you're breathing, instead of going through the mask, the air will go around the mask, and you will be breathing your air unless it's mask that forces the air to come through the filter. So that may be more technical than we want to get into, but that's we do have a question in our chat, and I will encourage anyone. We have 58 people watching live now. If you have a question, please feel free to put it in the chat box, and we will try to answer it. Al Gibson says, I think you might have addressed this question several weeks ago, but could you answer it again? Do the federal prison facilities in McQuarrie County report cases through your system, and are those numbers included in the daily information briefs? Yes, to the best of my knowledge, they do. Any case in Kentucky has to be reported through the system that I think it's called NEDS, that all infectious disease. It's a system where that's all captured and recorded. So we would know the location, and it would be captured in our numbers. Now, we don't, for the federal prisons, we're not really involved in their response in a great deal. They usually handle their own situation, but yes, the numbers should be captured locally. Judge Jimmy Green says, do you have any guidance on splash pads? We would not be able to provide anyone to monitor social distancing. I'll turn that over to Stuart.
And we are looking at that. There's so much guidance out there. I have to look at these separately when these questions arise to make sure that.
Well, Stuart, you look. There's another question I'll go to while you're looking. It says, as far as testing goes, do you know if there is a place in Somerset that can get results back within a few hours? Dr. Raymond, I'll let you answer that from a kind of a medical perspective, the benefits of the different types of testing, and if the one-hour testing is ideal, or I'll just turn that over to you and let you speak.
I know the hospital does rapid testing. I think they're not as reliable as the real test that gets sent to a major lab. So I wouldn't necessarily recommend those. We have had people who've had testing done in both places, and they're not always concordant. But yes, they do exist.
Yeah, and there is a place for those types of tests. Maybe, if you're going into like a homeless shelter or somewhere where the people may not be there in 48 hours, it's probably better to do a rapid test that's a little less reliable and be able to get the results while the person's present. But if better to get the test that's sent to the state lab, the swab test, or to one of the labs for lab confirmation. All right, Stuart, did you find that guidance? I've got some other things I can talk about. I think Judge Greeny's still looking for the guidance. So we had a couple of days ago on social media, we had someone that wanted us to report on the church outbreaks. And I did that, and I gave some commentary in our daily brief. If you are watching and you don't know, on our website and on our social media page, we provide a news brief every day that gives numbers as far as new cases, released cases, deceased cases, and then we give some interpretation of the data and some updates on what's going on. When I posted that answer to that question, someone asked the next day for me to explain the situation more broadly and talk about all categories, not just churches, and then to explain why would I think churches are more risky than some other situations. So you may have read this in the brief yesterday, but I'm going to go ahead and go back over that for the benefit of anyone who may have not read that and is listening in. I wrote yesterday, so we were asked to do a church-related update yesterday. We were further asked to do an all-around update today. We broadly categorize cases as related to or tied to either businesses, churches, long-term care facilities, medical facilities, or travel. Keep in mind that some cases are not tied to any of these categories. They may have just picked it up and they don't know where they got it at. And some cases may be tied to more than one category. They may have caught it at church and spread it at a medical facility, so they may show up multiple categories. So these aren't exhaustive categorizations, or are they mutually exclusive? But we've had 49 cases, 488 contacts, 3 hospitalizations, and 0 deaths tied to businesses. We've had 37 cases, 627 contacts, 7 hospitalizations, and 1 death tied to churches. We've had 123 cases, 578 contacts, 32 hospitalizations, and 23 deaths tied to long-term care facilities. 18 cases, 179 contacts, 1 hospitalization, and 0 deaths tied to medical facilities. And generally, when I'm talking about medical facility, I'm just not talking about patients that have been sent to medical facility. I'm talking about people that work at medical facilities. 12 cases, 61 contacts, 1 hospitalization, 0 deaths tied to travel. And then all the other cases, if you're trying to add up, were not tied to any of those categories. They may have not known where they came into contact with the disease, and they may have not spread it anyplace else. We were asked to explain why churches pose a greater risk than some other locations. And I put inside a church, or a factory for that matter, the 6-foot distance rule becomes less effective. Generally speaking, the 6-foot distancing rule is for normal breathing for a short period of time or with few others in a well-ventilated or open space. If you're singing or praising enthusiastically, this makes the 6-foot distance increasingly risky to ejecting more particles more forcefully into the air while you're singing or praising in an enthusiastic way. Not wearing masks, and some churches that are meeting in person are asking their members to wear masks, and some are not. But if you're one of the churches that's not wearing masks, this increases your risk more. The longer you are with a group, the more risk. The more people in that group that you are with, the more risk. The longer you are with a group in an enclosed space, even more risk. The older the population, and church members tend to skew toward the high-risk age group, or the number of people with compromised immune systems or other health issues, the more risk, or the riskier the interaction. Of course, shaking hands and hugging adds additional risk. Now, there are riskier places than church, such as daycares and bars. The daycares have just opened recently on a limited capacity, and bars are still closed. So we've not seen, at least locally, cases in daycares or bars yet, but in other parts of the state where daycares have been open, they are seeing COVID spread there, and the daycares are having to close because the attendees and the staff are being quarantined because they've been exposed to a close case. So those are difficult situations. I hope that helps with understanding some situations with church. On a positive note, it seems like that just from my observation, from looking at the data in sort of a superficial way with the churches, that in the churches that are more closely following the guidance, where they're keeping the 6-foot distance and encouraging wearing masks, they may have cases, but they don't seem to be spreading it inside the church as much. In the churches that seem to be very complacent with following the guidance as far as spacing and capacity and wearing masks, when they get a case, it tends to spread pretty aggressively in the church and result in a lot of exposures and a lot of conversions from being exposed into cases, and it makes it a more difficult situation. We've seen in factories where, again, that's an enclosed space with a lot of people, and if the factories are really aggressive on following the guidance on the distancing and wearing the masks, we've seen cases in factories that didn't turn into an event where a lot of people who were exposed ended up contracting it and testing positive. So really, wearing the masks and keeping your distance is really key. As far as churches go, the safest thing to do would be to have outside church meetings still, or drive-up meetings, or to do online meetings or some sort of digital or meetings. If you decide that you're going to have in-person meetings, observe the 6 feet social distancing and whatever the church capacity. I think it's up to 50% capacity now. Observe that, wear the masks. Those things will, don't know what else to say about that. That's just observe the guidance. So, Stuart, did you find the guidance for the splash pads?
Yes, I have that now. So, I just want to do a little bit of research before I gave the judge the answer. That is going to follow the requirements for the swimming and bathing facilities. Now, the judge's question is going to be, wouldn't be able to provide anyone to monitor social distance. So in the code, it goes back to the actual code on swimming, bathing facilities, which splash pads would be a part of that. And the code says that all facilities which do not provide a lifeguard must post and enforce the following rule. No person may enter the facility alone or swim alone. So you have to post it that nobody can be there alone or swim alone. But as far as the guidance goes, there is a requirement on social distancing. So, and I'm just going to read this. So public swimming, bathing facilities should take the water surface area. So in this case, Judge, it would actually be the splash pad area. Divide by 50 square feet to get the maximum capacity. So, for instance, if it is a 2,000 square foot area, pool or splash pad, it would have a capacity of 40 people to comply with the social distancing requirement. Of course, I know the splash pad there is less than the 2,000 square feet, so it would be less number of people. And then for maximum capacity within that entire facility, so in the park area where they're watching the kids at the splash pad, 36 square feet per person. And of course, no groups larger than 50. So that's the guidance. It does follow the swimming and bathing facility requirement from Healthy at Work. You're not required to have a lifeguard, but again, it does tell you how many people could use the splash pad at a time. So how you would monitor that, I'm not certain how the county would choose to do that.
I'm going to give folks one more chance to type a question into the chat. I'll swing back around to the church issue for a moment. We've been accused a few times of picking on the churches, and personally, I believe churches teach about love and mercy and grace and faith and things that we all need more of. We look around what's going on in our country and in our state right now, and if there's ever a time we need to elevate concepts of compassion and mercy and grace and love, it seems to be a time for that. So we certainly don't want to get in the way of anything that promotes, those kinds of things that our society needs to be healthy and successful. We just want, good people who's out there trying to worship their God and do the things that they believe are right to be safe while they're doing it. And it's been really personally challenging to us when we've seen these cases blow up in churches, because we know, it was people who were trying to do from a religious perspective what they thought was right, and it's just heartbreaking when something like this happens. So hopefully we're certainly not intentionally being hard on churches, and hopefully people understand that. I haven't seen anyone ask any more questions, so I guess we're about wrapped up. Tracy, was there anything else that we needed to cover today?
I don't have anything else. Is there anything, Dr. Wayman or Stuart, that you all want to share? No? Okay.
Well, I will always say, you know, that the best things that we can do right now as a community is follow the guidance. Wear your mask, social distance, try to avoid crowds. Don't be in confined spaces with people any longer than you have to be. Make sure you're washing your hands and not touching your face, and increase your sanitation. Oh, we got another question. As a pastor, thank you for keeping us informed. This is Rodney, Booe, I think it says. My eyesight's not what it was. It says, for keeping us informed. I don't envy your position. I agree with your sentiment. Wearing a mask is a small sacrifice to make express love to our neighbors. So, love, I'm taught, is the very greatest thing in the world, and the very greatest thing that ever was, the very greatest thing that will ever be. And the love that I know about is a self-sacrificing love, the love that God showed for us in giving His Son, you know, and sacrificing for our brother or our sister by wearing a mask and protecting them does seem like a small measure to take. So, I would encourage everyone from the concept of love to wear the mask so that you're protecting your brother or sister from potentially spreading to them a disease that can make them very ill. Russell County Board of Education, just a comment, Russell County Schools appreciates the partnership. Mr. Dye, the Russell County Health Department is working hand in hand with us. We appreciate the positive feedback. We're glad that we're able to be of some assistance. I don't know how much the public realizes how much effort that the health department is putting into working with long-term care facilities and hospitals and businesses and schools, and to, you know, try to understand the way this disease works and how to be safe. I don't envy your position as a superintendent or as a on the Board of Education or any school board. School's going to be a tough situation. You know, kids are it's hard to keep them on the track of following guidance on a good day, and you know, schools are tough. It's tough figuring out how to bus them and to keep the social distancing and the masks and those kinds of things. We don't envy you, but we do know that all the schools in our district are really trying hard to put together good plans and putting a lot of thought into it. Stuart, you might speak to that. I mean, you guys have worked with all the school systems, and you want to say anything about the plans they're putting together?
We've seen plans from basically every school district in our in the 10-county area, and I mean, they are really well thought out plans. You know, I guess where we're at right now is we're not sure where this final guidance is going to be. We were hoping that a document would come out today, either yesterday or today, that the governor has announced would come out, and that would be a public health document. So what we're waiting on, I think, most of all, is going to look at some of the masking requirements and also the transportation requirements that are going to be put in place. I believe I know that's what we're looking to see is going to happen, and I believe that's what probably all the schools are looking to see is going to happen. But I mean, there's been a lot of thought already put into these plans by the superintendents and principals and the board and by us also. When we get that final guidance, hopefully we'll be able to put something together good that'll work for schools. It's going to be different, a lot different. It's going to be difficult, a lot difficult, more than likely. But necessary. We're seeing already. We've seen some places now as schools go back to practicing sports or musicals or band or whatever kind of different clubs and activities they have. You know, we're already seeing where college teams have been impacted, where now high schools, are being impacted by a child that would have a positive test and then go to that practice and the practice, even though the child's asymptomatic, go to the practice and then other kids become contact. So it's going to be tough, and it's going to be hard to work through. But I would like to say that we're here to help every school do all those things. I mean, the health department is a partner with the schools, and we will diligently work with the schools to get us through the school year as safe as we possibly can.
A couple of final thoughts. On a positive note, we have seen cases, and I've said this different times on these meetings. We've seen cases in some very difficult places like nursing homes, jails, prisons, factories, and we've seen those cases not turn into a full-blown outbreak at that location. Now, we've seen situations where they have. But we've seen a whole lot more situations that haven't than have. So if you will be meticulous in observing the precautions, just because you have a case doesn't mean that like a whole industry has to shut down. They can remove the case, they can quarantine, observe the quarantine that the health department would have on the close contacts, and they can make sure they've sanitized and that all the staff are distancing and wearing the mask, and it doesn't have to turn into a whole place closed down kind of situation. So hopefully we can see that same kind of success in the schools, though we know it's certainly a challenge. One other, just to put this in reality, COVID-19, it's a new virus to the human species. Unless you've had it and recovered, you don't have an immunity, which means everyone is susceptible to catching it. There's not a vaccine yet, and it transmits really easily. So it's going to run its way through our society, either all the way up until a vaccine gets developed and there's an intervention, or until we reach what's called the herd immunity, when 65 to 70% of the population has had it and processed it. So, it's not our goal to stop it or to contain it. We would if we could. That would be our goal if that was a possibility. But what we're hoping is that it won't spread so fast that too many people get too sick too quickly, that it overwhelms our public health response or it overwhelms the hospitals. And the best things that the public can do to prevent it from spreading so quickly, and we can see just our numbers over the last few weeks is really picking up. And, I don't know if it's going to start compounding a lot quicker, but, it is picking up. So everyone can help out and do their part by observing the guidance, wearing the mask, social distancing, washing your hands, trying to avoid crowds, increasing your sanitation, staying home if you're sick, if you're coughing or have a fever, definitely stay home. If you'll do those things, you can really, really help the cause. So I don't see any more questions, Tracy, so I'll turn it over to you to close us out.
Thank you all for joining today. I want to remind you that next week we'll be on same time, 2 o'clock. If you have questions, please send those in to us and we'd be glad to answer them next week. You all have a good rest of the day.